Hey, what's up, everybody? It's Eric Whiteside Type Solution coming again. This time we're coming live with you. We're talking about hypertension. Last time it was there, Dr. Corey and Dr. Whiteside. We were talking about, well, I forgot already, type 2 diabetes and type 1 diabetes. We talked about diabetes. This time we're going to be talking about hypertension. So, with that said, let's go ahead and add them. What's up, Corey?
Hey, what's going on?
Hey, now what's up with you?
Man, it's another day in paradise, man. Just
Hey,
glad to be with you guys.
I feel you. I feel you. I'm glad you're here with us.
Yeah,
Glad you're
man.
here with us.
Yes, sir. Yes, sir.
We got Dr. Whiteside back there. He getting that little fresh cut. Ain't got no hair, so ain't got nothing to worry about. Hey, look, we the same boat.
Hey, what's going on?
Hey, what's up? What's up?
So we saving money on haircuts.
Oh, absolutely. Oh, absolutely. Look at them. Look at mine, man. I need to get new clippers, actually.
Hey, I do too. What's up, Jovar? Thank you for coming and showing up. So we're talking about hypertension. One thing in particular is that hypertension is known to affect the community as a whole. That's one of the biggest things. And what we tell people, we're going to dive into it, but we tell people it's not a black thing, it's not a white thing, it's literally a human thing. That's one thing we have to deal with hypertension. And most of the time, especially in the South, is dealing with the diet. Lack of exercise and diet is two of the biggest things. And one good thing here is, thank you, Dan H, for the 5x5. One of the good things here is that both Coy, you and I, we're personal trainers. So we do this we train on the side and do all of that. So if you have questions about fitness and nutrition, we'll talk about that as well. But we're going to dive right into hypertension. So Dr. Ibrahim, Coy, tell us what is hypertension?
Well, hypertension is basically your blood pressure being above normal. And your blood pressure is when we go to the doctor or we get screened, you get that blood pressure cuff put on and then they pump it up, or the machine put some pressure on your arm to see how much pressure is on the arterial walls of the body. And whenever it's above that 120 over 80, those standards have actually changed over the years, but 120 over 80 is right now normal. And anything above that is considered to be hypertension. And as it goes up, the top number is called the systolic blood pressure, and then the bottom number is called the diastolic blood pressure. And whenever those numbers rise incrementally, you can have different stages of that hypertension. And so obviously it's very important. Hypertension is one of the number one causes of mortality and morbidity. It is a key factor that lets you know how stressed the body, what type of stress that the body is undertaking.
Yeah, that's one of the biggest things. I know people freak out when they see the blood pressure. Mm-hmm. When it comes to blood pressure, just like Doc said, textbook is 120 over 80. Then from there, you pushing up. One thing we need to learn is borderline is around 130 over 90. I know for me, with a family history of high blood pressure, I tend to run anywhere, which is weird because, again, I work out a lot, but I run anywhere from about 110 all the way up to 138. It's like, why is such a large number? And again, that's one of the biggest things is diet. This diet. I do exercise, but at the same time it's diet and it's the water intake. So it's a lot of that me personally, that I actually have to watch. Mm-hmm. So when it comes to hypertension, what are some risk factors when it comes to hypertension? Because like I say, we know family history is one, but what else is there about it?
Well, number one is risk of heart attack and stroke. Mm-hmm. And that's the number one killer in the United States, of course. And I think above all things, that to me is one of the things that we have to really watch out for, because we can talk about blood pressure all day long, but when we don't do anything about it or address it, this can lead to premature death. And in some communities, of course, those mortality rates as well as risk factors are different in certain groups. And so we have to pay close attention to it. And obviously with heart attack and stroke risks that run in our country, a lot of it can be controlled with lifestyle and how we address it, and understand that many of these factors can be controlled if we get ahead of it. And so I think that's the main complication that we see with high blood pressure.
Cool. I know Joe Vi put it up on the screen. He's talking about the table. So it says, have they adjusted the tables and charts for body types? Because that's one of the biggest things we have, because that was an old standard. But from there, have they actually adjusted it? With you being that's well and out with the medical field, have they truly adjusted those to factor the change in America diet and things of that nature? Have they adjusted those charts yet, or is it still the same?
No, it's still the same. I mean, again, the big adjustment was when we had, at one point 140 over 90 was, anything up to that point was normal. And obviously that changed. And that's where we're at, that 120 over 80 at this time, but it's not really associated with body types per se. Now, one thing that you have to really make sure of if you're doing your blood pressure checks on your own is to make sure that your cuff, your blood pressure device, the arm, the cuff that's on your arm is adequate. It can cover your arm adequately. If it's too tight or too large, it can distort your measurement. So that's where you want to really make sure of making sure that your blood pressure cuff, your device, is calibrated properly, but also the blood pressure cuff is appropriate for the size of your arm.
Cool. I know that's one of the biggest things that I face. And it's so fun because I'm 6'1", about 230, I fluctuate anywhere from 215 to 230, depending on when I have my military fitness test, which is coming up anyway. So I was like, okay, let me drop real quick so I can actually meet those standards. Yeah. But that's one thing they're like, we can't find a blood pressure cuff big enough. I'm like, my arm's not that big. Not like I got 30-inch arms or anything like that. It's like, but that's one of the things I did notice when they put a smaller on me, there wasn't much of an accurate blood pressure reading as the one with a quote unquote the obese cuff. It's like, oh, y'all calling me obese? That kind of
hurt. According to BMI, right?
Right, according to BMI, yeah. Severely obese according to that BMI. Yeah.
Right.
Then they said my doctors can't believe my BP, which is blood pressure, is always raised when sick or hurt, but when perfect health, BP is normal or either low end or normal, which is actually a good thing. That's actually a good thing. What it's saying when it comes to that is when you're sick, the body is actually fighting an infection. So the body's pushing even harder. So that blood pressure is going to raise, but you have to factor in, is there a certain type of medication that you're actually taking that will cause that blood pressure to raise? But other than that, when you're healthy, that's perfect. You want it to be what we call the normal to the low end or normal. That's definitely a good thing.
Absolutely. Like when you are sick, just like you said, Eric, is that the body is under some type of stress. And you have to, make sure that you take that into account, much like, your glucose levels can go up. Your blood pressure can rise with illness.
Joe Vaughn talking about, are they adjusting the BMI index as well? In all honesty, you can take it away, Doc.
Yeah, that one doesn't seem like it's going to move. And the BMI really is just an indicator. It's a broad stroke assessment on individuals and how to assess their weight, but for individuals that are on the polar ends, that are really in shape or really out of shape or under or malnourished and things of that nature, it does not give an accurate account of that. So that's the quick answer to that one. They're not adjusting that one. Yeah.
Right. And that's one thing I face. Like I say, I got my fitness assessment coming up in October. And that's one of the things I'm always getting taped. It's like, dude, I have the muscle mass, but when it comes to the BMI, they do not factor in the muscle mass. And it's crazy. You think they would factor that in, but they don't. Then it goes with you got to get the tape, the neck, the waist and all that. It's like, yeah, you take my neck. My neck is about a 15.5. It's small. That's the first thing they take was like, okay, yeah, you made it. You good to go. It's like, you can obviously see that, but a lot of times people stick to the old school stuff. And that's one of the biggest things, like, hey, those are just numbers. Take a look at the person themselves. That's one of the biggest things. And with that said, what have you faced dealing with your clients? Because we know we talked about type 2 diabetes last time. When it comes to blood pressure, does that affect the diabetes as well? Or if they have diabetes, how does that affect their blood pressure?
Absolutely. So the big point is that the research shows that the medical community does not know where hypertension actually is derived from. They don't know what causes the high blood pressure. But one thing that the research shows is that there are six contributing factors that can lead a person to have hypertension. One of them is the main one is inflammation. The second one is endothelial dysfunction, meaning that the if you just think about the blood going through your vessels, it's a big tube, right? And just think about the lining of that tube deteriorating. And so endothelial dysfunction is basically the lining of that just continue to deteriorate, and that can cause inflammation, or it can be caused by inflammation. Well, what causes the inflammation? And that's what I do on a daily basis, is figuring these things out for individuals. One of them can be type 2 diabetes. And type 2 diabetes is basically your body's inability to get that blood, the glucose from the blood into the cells. And if it just parks, that glucose, that blood sugar just parking in the bloodstream, is very toxic. So these things affect it. And then it causes that inflammation. And that's where we see these cardiovascular issues come about with individuals, where we see markers like homocysteine, and we see markers like high sensitive C-reactive protein. These are key indicators as a person, why a person has hypertension, but also your risk of having a heart attack and stroke. But then also lifestyle factors like smoking, drinking, poor diet. All these factors come into play where the body's just deteriorating. And blood pressure just shows you, it's just a sign. It's just a sign that the body's not in balance. And so the key is finding those risk factors, finding those symptoms, and finding those key contributing factors to allow you to help you to reverse and then move in the opposite direction.
Okay, cool. Dan H talk, it says 6 feet, 200 pounds, 10% BMI. They don't like that. And they ain't like it in the Marine Corps. They don't like it in the Army, like say 6'1", 230. But even when I first came in, I was 6'1", about 180 pounds. And they still said I was overweight. They say, well, no, we need you down to 167.
Oh,
like,
boy.
Yeah, you ain't going to get that. That's just skin and bones. I'm like, you definitely not going to get that. And, I got down to 177, but look like a crackhead per se, It's like, nah, let me get this weight back. I can't. All my clothes were extra large, but it was so baggy on me. They like, something wrong with you? You want to tell us what's wrong with you? Why you lose so much weight? It's like, it's not like that. They worked me to death. And after a while, I'm like, let me gain that weight back, because I gotta have the weight. Right. But yeah, that's one thing we have to factor in. Going back to the BMI and stuff, we have to factor that in. We just can't get stuck on numbers. That's one of the biggest things. Can't get stuck on it. Joe Vaz so funny. Joe Vaz, he said 167. You on that stuff? Yeah. Yeah. They have me running. Maybe I have 5 miles in the morning, 5 miles at night.
That's high school.
In the evening.
That's your high school weight.
Yeah, exactly. You see, remember how skinny we were in high school? Yeah. So I'm glad we not to that anymore. One thing we want to talk about for those that are in the chat, one thing I'm just going to pose this question. It says, what's one healthy habit you swear by to keep your blood pressure in check? So reflect on what you're doing. So we got about 4 or 5 people in the chat. Reflect on what you're doing now. What is one healthy habit you swear by to keep your blood pressure in check? So you can post it in the chat. What is something you swear by to keep your blood pressure in check? Mine is exercise and diet. I got to watch the salt content. I have little ones as well, but in the South, I love that seasoning. Got to have the salt, but at the same time, I got to watch the salt content. But on the other end, got to increase the water content as well, because that's going with the kidneys and the urinary system. So I got to focus on that as well. So for me, it's the salt intake and the exercise. What about for you all?
Oh, for me in particular, I think that just being aware of your diet, being aware of your lifestyle in terms of exercise, and also stress management is key as well. Obviously, that's another factor that comes into play with blood pressure, is that when the nervous system is under stress, and we from a nice term that we always use is the parasympathetic and sympathetic nervous system. The sympathetic nervous system, that's the nervous system that the flight or fright, right? It helps you to guard you up, and you're ready to go to war, or you're ready to run away from that big grizzly bear, to get the system going. But anytime that sympathetic nervous system is as a driving force, your blood pressure is going to go up, because that's how the heart's beating, right? It needs to get blood to the tissues to be able to run, or to be able to fight off that threat. And so if you're able to calm yourself, practice mindfulness. Some people need therapy. Some people need to take a walk, do deep breathing exercises, yoga, exercise in the right manner, and for that person. All exercise for all people is not good for all people. So you have to really watch that. But, generally speaking, just making sure that you're able to get your mind in the right place to help that blood pressure to calm down.
Then they said constant walking and hydration. Those are the two biggest things: diet and exercise, and also that fluid intake. You got to drink that water. That's one of the biggest things. So you're on the right track. And just like you, that's what I've been doing. So, Dr. Coy, what about you? What are some things you're doing to make sure you keep that blood pressure in check?
Man, I just, exercise and mindfulness. I think that's a huge thing. Just, prayer, meditation, and just even rest. When your body needs that rest, you're on the go all the time, get that rest. Yeah, definitely.
Rest. What is that? What is rest?
Go to
It sounds
sleep.
nice.
That sounds real nice, man. But it can be hard for people. But one thing that we do see though is that that's a part of even the adrenals. That's a part of it as well. Is that when you're always up and going, and even we see some people that have a poor sleep pattern, whether they are they're not having the proper cortisol usage, and being able to have that connection with management of that cortisol, which is a stress hormone. Oftentimes we see individuals that have problems with insomnia, or having issues with their blood sugar, and those things. So really addressing that the best way possible. And that allows you to bring that blood pressure down as well, when you address that root cause of that.
Cool. And leading in that, because I love the way you talked about stress. And Joval pointed out a good thing. He's like, how does stress affect the immune system? So we know we talk about rest, where rest affects the immune system. So how does stress affects the immune system? And how does that lead into high blood pressure? How does that all correlate?
Yeah. So obviously stress starts in the brain, and the body is always trying to manage stress. And stress can come from different areas. There's obviously the physical stress, like if you have a physical trauma or something's upon you that the body needs to be able to handle that. But then we also have chemical stresses, and we also have mental emotional stresses. So all these different types of stresses that come about us, our body has hormones to be able to handle those things. Cortisol in particular is our stress hormone. We need cortisol because it helps us to wake us up. It helps us to get us going. It helps protect us, but it also helps us in regard to handling inflammation. So when we talk about one of the root issues with blood pressure is inflammation. Inflammation is an immune system response. We need inflammation, but in the right manner, at the right time, for the right function. And when we have issues with stress, that can really heighten up glucose levels. And glucose, obviously, you need insulin, and we have insulin surges that puts pressure on our pancreas, but it puts pressures on all different types of the body. It actually downgrades our immune system. And so that leaves us oftentimes. I don't know if anybody on this chat has ever experienced when they were stressed and had a really stressful moments in their life, they were just catching anything. They were catching all kinds of maybe viruses, bacterial infections, and things of that nature because the immune system is downgraded. And those that are in the military, it's just like saying, you know, the country is under big stress of being under attack and there's no defense to be able to combat it. And that's not a good sign, right? So when we have that stress, it downgrades our immune system. We don't have that proper immune system response. And these are the factors that come into play with blood pressure, because again, the body is just trying to fight off or trying to rev up. So the body's always having this tug of war and trying to manage the way to handle keeping your body in homeostasis. But it's a struggle when you're under a lot of stress.
Yeah, that's one thing I noticed when I lived in Charlotte and worked as a paramedic. We had that rotating schedule. It was
Wow.
6 a.m. to 6 p.m. for 2 weeks. Then we had 2 days off. Then it was 6 p.m. to 6 a.m. for 2 weeks.
Mm.
And you factor in not getting the rest like you were talking about. But at the same time, because you're not getting the rest, you're sleep deprived. But now on top of that, you have all this stress, of which you have your different calls. And it can be at any time. It's like, so you're just delirious. And I know for a fact, my first month or two, I was getting sick. I already had sick patients to deal with, but I was getting sick as well. Then that's why, like, you know what, I need to start taking in some supplements to help me out with that. But that's what helped my immune system. But the biggest thing was the rest. And then they finally changed the schedule because that rotating was killing everybody.
Yeah.
So they finally changed the schedule and I was able to get well. So one thing I know when I said the supplements, so do you recommend any supplements, or I won't say recommend, do you suggest any supplements? Because, you know, during COVID, the big thing was zinc, magnesium, and I forgot what the other one was. So with ZMA, those are the biggest thing. What do you say? Do your clients take that or what?
Yeah, I think, again, one thing that we have to always remember is that we have to look at the root causes of how and why a person has hypertension or any other chronic disease. And as a functional medicine practitioner, my main focus is always to look at the environmental factors that are present, but also the underlying causes or issues that are pertaining to inflammation. For a person can have inflammatory processes because of they're living in a sick house, so to speak. You know, they're underneath they have a lot of mold in their home or biotoxin threats. It could be from other areas that the body is not able to handle chronic inflammation. And so for that individual, understanding where they are by doing comprehensive testing first to understand where they stand, where it's not just for the sake of trying to give a person medication, but understanding something's not connected, something's not right, something's not allowing your body to have the proper blood flow and handle the stresses. And I think the best thing there is you obviously address the stress of why the body is underneath that stress. And again, like we talked about, it could be mental, emotional stress. It could be chemical stresses. It could be physical stresses. And for each person, you're able to find those missing links and those pieces. And supplementation may be for that person a solution, but not for everyone. The diet, the proper exercise, the proper stress management may come into play, but also addressing, okay, what's really driving that inflammatory fire? And, and we're trying to squinch that. We're trying to extinguish that fire that's going on. So for some people, it may be a solution, but again, you have to really individualize that approach.
Right, that makes sense. That definitely makes sense. One thing Joe was talking about coffee. That's a supplement. Look, I don't drink coffee. I take pre-workout, and I know that's even worse because I got a strong tolerance now. So I started with pre-workout, maybe 50 milligrams of caffeine. Now I'm up to 500, almost 1,000 milligrams of caffeine now, which is bad. It is bad. So that's literally my coffee. I try drinking coffee. I mean, I go to Starbucks. I'm a fake coffee drinker. I get the frappuccinos and all of that. But in all honesty, for me, it would be the pre-workouts, and that is bad because that's a lot of stress on my vessels, and I have to take in a lot of water, and that's not a good thing, especially with me going on. Well, how old am I? 47, 48? I think I'm 47.
Something like that.
Something I know we were around the same age. So I think 47. So when it comes to that, that's one thing we got to factor in now. Hey, all those supplements I was taking when I was younger in my 20s and 30s, I really can't take that now because again, you have to factor in the vessels and all of that. And that's one of the biggest things that for me, I'm trying to wean off of it, but I was like a crackhead. I was like, I wake up on weekends. I know I don't need a supplement. It's like, I got to deal with these kids. Where's my pre-workout? Let me put 2 scoops in real quick. Then I can get my day started. So a lot of people have coffee. For me, it's that pre-workout. I got to stop it.
But that's a good point. And in my world, I'm always thinking about supplementation that is actually going to be beneficial for the patient to help reverse their condition. But just having this conversation here, there are also supplements that, that try to help you to enhance your workout and things of that nature. But when you have those supplements that are stimulants, that's stimulating your ability to get that blood flowing. And so, so it's going to raise your cortisol levels. It's going to raise your blood sugar levels. And that's something that you don't want to do just for the sake of getting a good workout in. It's actually, again, it's like I said before, one of the contributing factors is endothelial dysfunction. And that's just basically the lining of the blood vessels just deteriorating. And that's not what you want. You don't want to add things into your diet or add things into your lifestyle that actually contribute and cause you to have those inflammatory processes. Because exercise is a good thing, but again, it's a type of exercise, but also what you do to help you enhance your exercise that can actually be more harmful than good.
Yep. Cool. Makes sense to me. So I'm gonna get with you in a second, Joe. I got you. So I know one thing we were talking about was, let me look at my cheat sheet right here on my phone. Holistic strategies like diet, stress management, and things of that nature. Do you suggest any other holistic? Because our biggest thing is for us at WTS and even for COI, when it comes to COI wellness, we want the holistic approach first. Because let's be honest, back in the day, they didn't have all these supplements. They didn't have all this medication that they do now. So the objective is, which we know now, they're switching back to going holistic, not holistic, holistic. So what other suggestions do you have about that?
Yeah, I think going to my earlier point, first getting tested properly. Just like if you take your car in, there's something wrong with your car, get the testing, so that you can be able to understand how the systems of the body are working together or the lack thereof. From there, obviously addressing these stressors, understanding what are the stressors, but also understanding that there are numerous systems of the body that allow you to have good blood pressure. Obviously, with looking at your inflammatory processes, looking at your kidney function, looking at your stress, looking at all those factors. And that's where we look at from a holistic standpoint, there's something wrong, something missing. And the only way you can really figure that out is looking at it from the standpoint of what is the root cause. It's coming from somewhere. And obviously the traditional medical model for some folks, if their blood pressure is extremely high and they're about to stroke out, medication is there to try to bring that down. And hopefully, you can get it to a better state where then when it's stabilized or get to a better state and trying to get you out of that stroke risk, that then you can start addressing things that are causing that, your lifestyle. And so obviously with some individuals, exercise may be helpful. For some people, again, readjusting your nutrition is very helpful. Adding in, nutritional supplementation may be helpful, but also addressing your mental emotional stresses as well. And that may be with counseling or therapy and things of that nature that may need to be addressed there.
Makes sense to me. Makes sense to me. Joe says, how does those supplements affect the adrenal gland? So we did talk about the fight or flight and everything of that nature. So we're talking about the norepinephrine and epinephrine.
That's
so
right.
when it comes to the central nervous system or the sympathetic nervous system, how does these supplements affect that?
Well, so one of the tests that I like to do is to test the adrenal function. And you get to see that front and center with, I'll do a saliva hormone test to look at your cortisol levels. And the cortisol, which is your stress hormone, it lets us know your output for the day. And when we look at that, we can see if there's a disruption in what we call a circadian rhythm. We're supposed to have certain, like, for instance, if we wake up in the morning, we have a typical day. We wake up in the morning and go to sleep at night. The cortisol levels should be at its highest in the mornings, right? Because it's waking us up, it's getting us going. We get going in the morning. And then as the day progresses, it's supposed to kind of slide down gradually so that we're not as, we need stress. We need that hormone, that stress hormone to help us get through the day, help us with brain function, help us just, with energy, the proper function of our body. But then as we go through the day, it's supposed to slide down to get to a place where we're ready to go to sleep. Some people don't have the proper circadian rhythm. Mm-hmm. And depending on where they are in their health, some people need to stimulate that cortisol or develop that cortisol. So there may be supplementation and also diet, but also addressing even sleep-wake cycles and other stressors that's going on with them to help the adrenals to catch up. The problem is that if the body is under a lot of stress, either you're having too much cortisol or you're not producing enough cortisol, that's going to affect many things, including your blood pressure. And we need to reset that circadian rhythm by addressing these root causes, and supplementation may be able to help with that. Now, some supplementation may be counterproductive. Like I said, with the caffeine, the caffeine is not so good either, or even the ginseng and other stimulating types of supplementation is not all good for all people. So again, that's why I always go back to the testing. The testing doesn't lie. And then that way you can be able to craft and individualize a program to help many factors that include blood pressure.
Ooh, makes sense. One thing Dan A's talking about, but I like to taste my Red Bull, Doc. Hey, Dan H is so funny because I live in the Atlanta area, and driving to Charlotte or North Carolina is not that far. It's nothing but a 3.5 hour drive.
Right.
But I know when I went coming from Louisiana to Atlanta, there's no lie, I had 2 Red Bulls. This is all within an hour. I had 2 Red Bulls, 2 frappuccinos. But with the frappuccinos, I had 4 shots of espresso in each one. In addition to that, I had my pre-workout all within an hour and a half to keep me up. And one thing was unique or interesting was there was so much caffeine that it did the opposite. It made me sleepy. And I didn't know that. I was like, why is this doing the opposite? I'm supposed to be wired like a crackhead running around, but it literally did the opposite. Mm-hmm. So that's something very, very interesting. That for me, I need to take into account of like, that's just way too much. My body probably was like, yo, this is too much. We're just going to do a dump and you're not going to do it.
Yeah, we're going to shut you down. Yeah. I mean, and that's again, the body can't take on that amount of stress. Again, it's like just continue to just put your foot on the pedal of the car eventually it's gonna, it'll get you from point A to point B every now and then, but as you do it prolonged, it's gonna wear that engine down, and it's gonna wear your body down as well.
Yeah, I'm noticing that now. Like right now, it's only for me over here on the East Coast. It's 8:35, and I'm struggling. My little kid's like, "Daddy, why your eyes red?" I'm like, "Yeah, I'm struggling trying to stay awake." So, G23, what's up, G23? He says, does having low sodium levels raise your blood pressure? So, does that?
Yeah. So one of the other areas that is of concern is that in regard to blood pressure, as I said before, inflammation is a contributing factor. Endothelial dysfunction is a factor. Oxidative stress, that means that the body is under a lot of stress where the cells are actually dying and breaking down. Renal dysfunction, that's your kidneys are impaired. And then we talked about that sympathetic nervous system, the overdrive, that stress. But then another factor is hyperaldosteronism. That's a hormone that is developed from your adrenal glands that help you with management of water and sodium. So lots of times, when you have issues with your blood pressure, the body is not able to have that balance of aldosterone. And aldosterone is a key factor with that balance of sodium and other electrolytes that we see. So oftentimes we hear in conventional spaces that you got to watch the sodium, and sometimes, for many people that can be a misleading, because if you're not able to have that balance of good aldosterone, that's going to throw your blood pressure off, thinking that it was the fries that you ate. But it's really, again, the body is not able to have that balance and having that sodium. So again, that's another key factor. That's why testing is key. Testing is king in my world, because you can go barking up the wrong tree and and totally miss the boat on what is causing your blood pressure to be high, what's causing your glucose to be high. And so I think it's key there to really understand how aldosterone helps with your management of your blood pressure. Some folks don't have the proper balance, and the testing will help with that.
Cool. Hey, Urban. Hey, thank you for coming to check and hang with us and learn a little bit. If you have any comments, drop them. You got any questions, drop them. Fam, what's up, fam? You see I'm rocking the black and gold right now. I can't do that blue and white right yet, but I'm rocking the black and gold. I do the blue and white a little bit, but not too much. Not too much for you. Dan H said one thing here. He said, are you able to name 3 good supplements for us? Now, when it comes to that is, which I don't want to steal your thunder, but for when you say us, it's going to be different for everybody, to be honest with you. So that's one thing for me. Supplements for me may be good, but may not be good for you. But are there 3 in general supplements that we should think about taking? Just a recommendation or a suggestion. Like we talk about the zinc, the magnesium. We know the cold and flu season is about to come. COVID is ramping up. We have another strand of COVID. And I'm a school teacher, and my kids are being knocked out left and right with the COVID strand. So we know we're talking about elderberry and things of that nature. Anything that you suggest over the counter would help?
Well, it's very hard for me to say, because I really operate on the individual to understand what's holding them back from the proper health. And I think the same way when you look at the traditional medical model, the traditional medical model would choose to use medications to manipulate or to change body chemistry to emit a certain result. Same thing I see, either holistic practitioners, sometimes they'll do the same thing with herbs and supplements that are over the counter. And sometimes you have to really be careful with that. And oftentimes I'm very careful with that as well, to say that this particular supplement or that particular thing to do, it may work for some people, so to speak, but it's not something that I was prescribed to, like, say, amlodipine, for a patient. Sometimes, as you know, that some medications don't work. I had a patient that came in to my office, and she was on 4 blood pressure medications, 4 different ones, and none of them really worked for her and really addressed the issue. So you got to start thinking, well, what's up with that? It's got to be something else underneath the surface. We do testing, and then we see a whole myriad of different things that are not right. So again, you have to get the proper testing and have that approach that, okay, well, what's driving this issue? Because again, you take a supplement, it may not even work because you have what's going on in your life. And that's not a supplement is not going to take away your stress, so to speak. But I think that's the approach that I would take with that.
Okay. G23, that's a good thing. You have blood tests every 6 months, max a year, which is actually a good thing. In all honesty, the older we get, the more we need to utilize, if you have insurance, the more we need to utilize our insurance. And that's why I like having 2 doctors here. That's one thing. And they're straight up with you. They give you the reals. Like for us, for me in particular, I pay insurance. If I pay insurance, I will just sit on my doctor's little seat or whatever. I'll sit there. What you need? I don't know. I'm just paying. So, hey, I'm just here. Hey, how you doing? I talk to you. It doesn't bother me. But that's one thing we need to get in the habit of, actually seeing our doctors more often. That's one thing we don't do. And I can't stress that enough. That's one thing we have to start seeing the doctors more often. Hey, Gina, thank you for coming in. You said the 3 medications, which is very unique, because I figured that would contradict each other when it comes to that. You have 3 different ones. They're all supposed to do almost the exact same thing. One may be more of a fluid pill than anything else, but comes to that, would a pharmacist actually catch that?
Not all the time.
Right.
And oftentimes you have to be careful, because you can go from one practitioner to the next. And when you go see one practitioner, this doctor is prescribing your medications, and you go to this other doctor that's prescribing medications. And sometimes there are going to be some interactions with those medications. And that's something that I see oftentimes, is that, if you look at the list of medications that are on their list, if you don't look at the interactions, then I look at the interactions. Let me just say what I do. Looking at those interactions so that you can see how those can play into their symptoms. And it's interesting how, even when I see my patients that I deal with, reverse and type 2 diabetes, all these medications are just counteracting with each other, and you're addressing the root issue, and the blood pressure starts coming down. Their blood sugar starts coming down. And oftentimes, when they get to a better state of health, their lifestyle and addressing those root issues, their blood pressure drops like a rock. And I have to tell them to go back to their prescribing doctor to say, hey, let's start to reduce and eliminate the dependency on these medications. And so it's really key that you stay on top of those things, and how how your medical doctors that are prescribing, how these things affect you, and staying on top of it. And if there's a change, just don't keep taking it without having that advisement on what's going on with you, because that can also be a problem when blood pressure drops too low.
That's one of the biggest things, like he was saying, for everybody in the chat. That's the biggest thing. Challenge your doctors, question your doctors. And these 2 are not afraid of a challenge. That's what it is. That's what they went to school for. They love the challenge, because having that challenge, or you questioning, allows them to teach. That's what we do. We're all teachers. It allows them to teach you. If you're taking 3 different blood pressure medications, why are you taking these 3 different ones? That's what you should be asking your doctor. Why am I taking all these medications? If you're prescribing it, explain to me, why am I why am I taking it? Do I really need all three? Can I wean off of it? And ask, how long do I have to be on it? These are the things you should ask your doctor. Don't be afraid. You're paying them theoretically with insurance, but you're paying them. So question everything. This is your life we're talking about. They're going to see you 10, 15 minutes, maybe 30 minutes. You're out. They're on to the next patient. Medication is something you're going to have to live with for a while. So you want to know why. So question everything. G23 said, I'm getting with you in a second, Joe. G23 said vitamin C, D3, K. That is, I'm assuming that's vitamin D3 and potassium too, and zinc. Is that what D3 and K2 is?
Yeah, vitamin D3, K2, like vitamin D.
Okay.
Yeah. Mm-hmm. What up, Doc? Got a fresh cut. If you like us, no hair, you wouldn't have to worry about a barbershop.
Now, can you hear me?
Yeah, we can hear you.
Okay. Yeah, no, I agree with Dr. Coy about the medications. Sorry, I was on mute for quite a few of the stuff. So one of the things is when it comes to medications, I have to let people know not every medication works on every person. So the general medical community say, here, take this medication, it should work, and they're going about the business. For me in particular, there are certain medications such as what Dr. Coy is talking about, your amlodipine, which is a calcium channel blocker. This particular medication actually works very well in the African-American population. So that is one of the main ones I will prescribe for the Black community. There's another one where I will prescribe a certain medication, but I notice that most of my patients are not controlled on specific medications. I will try them on a certain medication that I'm familiar with, and from my years of practice, I know will work. But Dr. Coy is actually right. From the underlying cause, you got to figure out the underlying cause. Once you treat the underlying cause, then everything will, or the body tends to go back to normal. So you have to try to figure out which way to reverse the effects to decrease the inflammation so the body will calm down. Because anytime the body's under stress, you're going to have inflammation. That's all you're going to have. Like Dr. Coy said, you're going to have your parasympathetic and sympathetic nervous system rev up depending on what's going on. Typically, it's your sympathetic nervous system, which then will increase your inflammation, increase your cortisol level, which will then, as somebody mentioned earlier about the immunity, decrease your immune system, which increases your chances for colds and just getting sick in general. So just trying to control the inflammation. Somebody also posted talking about the water. Water is great. You want to flush your system because you want the body is just used to being natural. Like I said before, it's used to homeostasis. So you want to just flush all the impurities out of your system to see what's really going on. And then exercise. Walking is good. I do recommend walking, but strength training as well, because strength training itself will actually put stress, positive stress, a good stress on the body to strengthen the heart and also strengthen the muscles, which will then help with controlling your blood pressure. And also let people know, because a lot of people think your blood pressure is controlled by your heart. It is not. It's actually controlled by your kidneys. So when I get my patients, I actually see what's going on with their kidneys and making sure the kidneys are fine. If something's going, and I do several tests as well. If the kidneys are off, it's going to affect the adrenal glands. It's going to affect most of the mechanisms that controls your blood pressure. So I got to figure out where in that mechanism is affected to determine, is it medication I can use or is it something else I can do?
All right, so Urban Garden Chronicle, magnesium helps with high blood pressure. But for her, she said, I haven't seen any improvement. Is there a specific one that she needs to take? So again, you were actually, and I know Dr. Coy said this earlier, you actually have to talk to your primary care physician when it comes to that, the prescribing one. But in general, when it comes to magnesium, does magnesium help with blood pressure or does it? How does that work? Whiteside, Coy?
I say it does. I like magnesium. So what magnesium does, it works on the smooth muscles of the body, and it gets the smooth muscles to relax. When you get the smooth muscles to relax, it allows better squeeze and more efficient blood flow through the body. So magnesium does help. When it comes to which magnesium oxide, that's generally the magnesium you want. You don't want to do magnesium citrate. Magnesium citrate works on actually moving your bowels. So it's magnesium oxide. The other thing is too much magnesium in your system, you're going to have loose stools and diarrhea. And that's the biggest downfall. So typically I'll see patients on one, maybe two. So one in the morning, one at night. But to be honest, not every supplement works on every person. That's the thing. And it's just when you practice medicine, it has to be individualized. It cannot be generalized. So that's what Dr. Coy, and I agree with them. each person is treated differently. What medicine might work on for Dr. Coy might not work on for Eric Whiteside, might not work on for Derek Whiteside. Every person's body responds differently to medication, so we have to figure out what in particular will work and what's the underlying cause.
Cool. Coy, you want to add anything with that?
No, I think, again, I think that the key to it is the testing, especially when if you see that a nutrient is deficient in the body. Obviously, you have to say, okay, why is that deficient? And obviously, you want to find that root cause, or find that why the body is not allowing that nutrient to be utilized properly. But even a lot of times, we can lean heavily on these supplements, but then if your body's not absorbing that supplement properly, that's just as bad as well. So sometimes, if we see it in the blood and it's like really high, but then, we also have to see, well, based on symptoms, based on function, if, it's still showing that the body is not receiving it, you can test for that to see if the body is receiving that nutrient properly, getting the proper absorption. So that can be a key there. So again, it all comes back down to individual personalized care. And everybody's different. So you have to really look into that.
Okay. So Urban, just like I said, go to your primary, your PCP or your primary, and ask them, challenge them. That's one thing I know Jova said as well when it comes to right here. Ask questions. So go to your doctor. I think typically y'all have chats, right? If they can send you a message and you can respond that way. Is that how that works with y'all?
Yeah.
I didn't get that. What was that?
Okay, so let's say if I have a question and there's after hours, do y'all have like a chat you can send for typical doctors? As chat you can send a message to, and you may see it in the morning time. You can respond that way.
Absolutely.
Okay, so yeah, so Urban, tell your doctor, hey, this is what I'm on. It's not working. Do you have any other suggestions? He or she may tell you to come in and do the blood work. That's going to be one of the biggest things that's the key. That blood work. That is the perfect indicator. Me being a phlebotomist, I draw blood all the time, and that's one of the key things working with Dr. Coy, working with Whiteside, that would indicate what's going on. That's the missing link. So it's like you have a large fire and you're doing a sprinkler system, a small sprinkler system on that fire. You really can't put it out because you don't know what the true cause of it is. So having that blood drawn and actually isolating those factors or those key components let us know, hey, this is where we need to focus in more on. So that's going to be one of the biggest things. So good question. Great question on that. Where am I? Right here. So G23, how often should one see an endocrinologist, or should one or endocrinologist be part of the team? What are your suggestions about that?
I personally don't think so. No endocrinologist. And I say that from the standpoint that if you're looking for an endocrinologist for your blood pressure, then no. If you're looking for an endocrinologist for another specific issue, yes. You want to look for a nephrologist, which is the kidney doctor. They're the ones that do a lot with blood pressure, even a cardiologist. But typically your primary care provider is going to be the one that can manage blood pressure. It's part of what we call our bread and butter. We do it on a regular basis. And if we as a primary care provider do struggle trying to manage the blood pressure, then we actually get a nephrologist involved. And the nephrologist will actually order a lot of the tests that Dr. Coy was saying, your renin, your aldo, and some other specific lab work. We'll also even order scans to look at the endothelium that's going to the kidneys to see what truly is taking place. Because there are some people who will be on 5 or 6 blood pressure medications. And to me, if you're on that many meds, when I see that patient, I like to figure out, well, why are you on so many meds? Are we maxed out on the number of meds? What have we done? I like to question why you're on so many meds, because I know if I was a person, I was taking a bunch of meds, I would get tired of it. I really would. So I want compliance. So I need to decrease the number of pills you're taking, but I need to make sure the pills you're taking are efficient and working the way they're supposed to. But still, it comes down to testing. That's the bottom line. We have to figure out what's going on in the body.
Totally agree with that.
Okay. G23 is talking about my veins like playing hide and seek. Hey, I can start IVs upside down through a sunroof at nighttime. So if you got veins, I'm gonna hit them. It don't matter. So if they play high seat as a phlebotomist, as a medic, we can start that IV. We can draw that blood from you. So you ain't got to worry about that. I can tell you now, one thing is, especially when you get a lot of blood drawn, that's for everybody. A lot of nurses will tend to draw blood, but at the same time, if you can request a phlebotomist, because that's what we do. We literally draw blood. We're vampires. We love blood. I hate to say it like that, but we love blood. So we focus on drawing blood, and we have more experience, not knocking nurses at all, but we have more experience with the drawing of the blood. So when you come to that, ask for a phlebotomist. Hey, can I get a phlebotomist? Especially if you have rolling veins or something of that nature, ask for a phlebotomist. We get it in a heartbeat. Knock it out for you. We're done with it. So great questions, y'all. I love this. Great questions when it comes to that. One thing in particular here, let's see. Challenge your doctor. That's what we talk about all the time. You want to challenge that doctor. Ask that doctor thousands of questions. Excellent job. Any other questions from the chat? Because I love this. Any other questions from the chat at all?
Now, somebody did say challenge your doctor, ask questions, bring somebody in. Now, I'll be honest, you can bring somebody in, but the doctor, it is their discretion if they want an extra person in that room or not. And if they get tired of a particular person that's not the patient asking questions, they can remove that person out of the room because it's really only for the patient. So I would just say be mindful of having an extra body in there. But I do tell patients, write everything down on a sheet of paper. Bring in, if it's 20 questions, you're paying me to take care of you, just like you're paying Dr. Coy to take care of you. You want to make sure all your questions are answered. As a provider, I like to make sure they understand why they're taking a specific medication. And if there's a way I can get them off of it, what the game plan is. I don't want a patient just to take a medicine just to be taking it. I don't like prescribing pills just to give them a pill. I need them to know this is the reason why we're doing this. If you would exercise, I don't ask you to go run a marathon. If you'll walk 3 times a week for 30 minutes at a time, let's start there. There we can work on decreasing, really it's the inflammation that's taking place. We can get that part down, decrease the pills you're taking, and possibly get you off of medication.
Okay, cool. Dr. Coy?
No, I mean, I think that approach with Dr. Whiteside is very accurate. You know, I mean, the key is just making sure that I'm just going to keep beating this horse is the proper testing, you know, individualized care, and just staying on top of, you know, understanding the levels of care that you're receiving. And also I would say, you know, what is asking your doctors, what is the plan? What is the short-term and long-term plan here? And I think that helps with not only compliance, but, you know, just I'm a goal setter. So, you know, being able to set standards and set goals that allow you to be alongside your doctors and the approach that they're taking. And hopefully that agrees with you and your belief system, but also how you see this progressing. And so I think that's the key there as well, is just making sure that you're both on the same page on how your care is going, and asking those questions. And sometimes that can even illuminate how that doctor perceives you. And I think that's equally as important. And if your goals are to stay on medications for the rest of your life, then the doctor more likely will go along with that, depending on who you talk with. So sometimes patients will say, well, I hate taking these medications, but then their lifestyle doesn't match the fact that they're wanting to be off the medication. And so what is the doctor left with? You keep coming into the room saying, and the testing doesn't lie, the blood pressure is through the roof, and they don't want you to stroke out. So their ultimate goal is, hey, let's get this thing under wraps. Hey, I've done my duty. What are you doing?
Mm-hmm.
And that's where sometimes the disconnect comes in, that I see often, is that, hey, the blood pressure's not going down, the blood pressure is not working, but then there's no collaboration, true collaboration where you're giving all the proper information that the doctor may need to help you.
Mm-hmm.
And so that's how I see it.
Okay, cool. Urban was talking about, she said, so is salt okay? Then she said Celtic salt. Look, all I know is sea salt and just regular salt. So can y'all help her out with that one? Because that's way above my pay grade.
I'll let you do it, Dr. Coy. I have a different opinion, but I want to hear what you say because I'll probably be agreeing with you.
Well, I think again, when you look at, I'm a fan of pink Himalayan salt, and generally with that, obviously it's going to have, it's not going to have the iodine in it, but it's going to have some key minerals in it. And the key minerals we're talking about, obviously, is the sodium, the chloride. These are factors that help you with your electrolyte balance. And I think this is very important for individuals, oftentimes where we're seeing individuals that have poor management of their blood pressure, but also poor energy management, because they're not getting enough electrolytes in their system. So one of the areas there, which we'll always look into, again, for that individual, again, we have to test and we have to make sure that we're in the right place, is if we're seeing issues with key vitamin and mineral deficiencies, you have to address it and find out why that's going on. For some individuals, it may be they need more sodium. Some people may need the magnesium. Some people may need the vitamin D, all these other factors here. But again, for me to lean and say, well, this is going to help that, and there's a direct correlation for that individual, that would be irresponsible of me. But again, the testing will come about to really help guide that individual to the optimal care that they need.
Whiteside?
I put you on mute, sorry, because you had a little bit of feedback.
No, you're fine. No, I agree with Dr. Coy. The pink Himalayan, I love that salt. It's a good one. It actually tastes better than the salt with the iodine in it. That's just my preference. But the thing is, too much of something is bad for you. So you got to find a healthy balance. Yes, the body needs salt, but it only needs a certain amount of salt. I can't really tell you you need this amount of salt. What I can say is that if you want to put salt on your food, keep it lightly salted. That's the main thing. Just literally a pinch, a tiny pinch. You're not trying to drown it in salt. You don't want to taste that salt flavor. You just want to get a slight hint of it. The more salt you have on it, actually, the more water it brings into your system. The more water that's in your vessels, the higher your pressure is. That's why we put people on water pills, to get them to pee it out, to get the pressure to go down. So salt will cause elevation in blood pressure. But if you watch how much salt you're bringing in, then keeping it low is definitely fine.
Dr. Coy, did you want to add anything? You good?
No, I'm good.
Okay. All right. So here, G23, I ain't gonna lie, I didn't. I wrote it down, and look, I ain't gonna be honest. I got my pen and paper now. So put in the chat the name of those two movies again. I'm gonna watch them. Look, the only movie I actually had time to watch between all these little kiddie shows was, what's the new one out, Deliverance or whatever it was. That's the only one I watched, to be honest with you. So if you put that in the chat, let me know. I'm gonna do it this weekend. I promise I'll do it this weekend, and I will be on She Fires Live and report back to you about those two movies. Hey, Shawnee, how are you? I'm glad you can make it with us. Anybody have any other questions? I know Dan H put here, he talked about how much iodine is bad for you, and I know Dr. Whiteside, Dr. Coy, you all did hit that as well, and you just want to have the hint. To be honest with you, I didn't know that. I was like, I'm gonna put enough season until I can taste it, but y'all say just a hint. Hey, that would make sense, because I'm drinking a whole lot of water. I'm peeing like a water buffalo. So that does make sense now. So anybody else in the chat, did y'all have any other questions? Because I know it's about 4 minutes after the hour, so I don't want to hold you all too late. In addition to that, we know it's Monday Night Football, so it's the start of the football season. So we definitely want to hold you for Monday Night Football. So
now,
y'all have any?
Sorry, it's talking about how much iodine is bad for you.
Mm-hmm.
You don't want to add any extra iodine to anything, because it can be detrimental to the body. So you do not want to add any extra iodine. If your salt is iodinized, that's fine. But that's about all you want. You don't want to go out and take extra iodine supplements, because the iodine will become toxic to the body. and will cause destruction to a lot of to the cellular system.
Okay, all right, that makes sense. Dr. Coy?
No, I agree. I'm always on the side of testing properly and finding out where the deficiencies are. And again, I do agree that if you can easily, add too much of something, and lean heavily on it, and obviously that can be toxic to the system and be counterproductive. So we have to address that.
Okay, cool. And Joval was talking about heavy metal toxicity as well. So that's where that comes to play, heavy metal toxicity, which is true. Dan H, thank you, Dan H, for joining us. Like I said, it's 5 after the hour now, so I want to hold you up anymore. Dr. Coy, start with you. Any part? No, Dr. Whiteside, start with you. Or look, fight to the death. Whichever one don't matter to me. Either one. Any parting words? Because don't want to hold them up too much longer. Any parting words? Any suggestions? And for those in the chat, if there's anything, other topics, because I know we're more educational, so it's not the entertaining per se, but we want to make sure you all have this information. And we have 2 docs on here that will tell you the truth. And that's one of the biggest things. So if there's any questions or any topics you want us to talk about, please let us know. All right, G23. Okay, cool. I wrote them down, and I will definitely get back with you on that. Oh, I think Whiteside just dropped out. Dr. Coy, any parting words?
Yeah, I mean, I love this topic because as a functional medicine practitioner, my goal is always to look at the root cause of chronic disease. And these diseases and these signs of chronic disease, it's very troubling in our community. Again, with high blood pressure, it's the number one of the top keys to a risk factor to mortality and morbidity. It can be coined a silent killer. It doesn't necessarily have to have a debilitating symptom, but the symptom is the blood pressure. And there are numerous reasons why a person is going to have these blood pressure issues, and it's something that you don't want to play around with. The key to it is getting the proper care, getting the proper testing done. With my office, I'm always looking at the why, answering that question. And of course, if that is something that someone is that's on this call is hearing and needs to understand why they are hypertensive, my office is available to consult with them, but also to go forward with qualifying them for care. I am Dr. Coy Wellness Solutions on everything, IG and Instagram, and also do webinars concerning type 2 diabetes as well, how that affects blood pressure as well. And our office number is 954-637-2990, 954-637-2990. And if you're interested in doing testing, specialized testing, or even looking at finding a holistic way to handle chronic disease such as hypertension, we're available.
Cool. And what we do is we definitely put all this information. We'll put in our community tab, and I also put it on our social media as well, so you have it. So feel free to reach out. You have 2 of the greatest doctors here. Yes, I'm biased. So 2 of the greatest doctors here, 2 of the greatest doctors in the world. I don't know about my brother because
man.
But yeah, we have 2 of the greatest doctors, and they're straightforward with you all. This is something that we truly love, and as you can tell, we're very passionate about this. I'm not on their level yet, but I'm still watching all these Grey's Anatomy movies. So I'll be there soon. I'll be a YouTube doc eventually. But seriously, if you have questions, you reach out to them. I'll put his social media, his information on our community page. I'll also put it on our social media, and we'll tag him and everything. Please reach out to him. Please reach out to him. One thing I noticed, G23 said these are some things he would like for us to hit: ADHD or ADD, which is very big, especially in the school system. You wouldn't believe. I have a class of 43 students. I have about 12 of them that is either ADHD or ADD. I'm like, this is ridiculous. And I go back to the foods that we eat and things of that nature as well. So that may be something good to talk about. And this one, how you say it? Neuropathy? Neuropathy. Yeah, I knew that. I was gonna get my Google Translate from it. Neuropathy. So, okay, cool. Those are two things. I'll write those down now, and we'll definitely hit that. Neuropathy, that will actually go into, would I go into thyroid as well? Would I lead into thyroidism, hyperthyroid, hypothyroid?
Diabetes.
Diabetes. Okay.
Diabetes.
So you're talking about hormone levels. Oh, that'd be perfect then. About that. We'll talk about that next time. So I'm writing those down. You see, writing it down now. I got my little handy dandy notebook, writing it down. So we'll definitely reach out to you, post something about that as well. Definitely with the hormones level. Dr. Whiteside, is there any parting words? Because we're 10 minutes after the hour. Don't want to hold them up.
Yeah, I'll just say that from lab testing standpoint, somebody said to get lab tested about twice a year. That's fine. That's definitely not a problem. I would not recommend it any more than that unless you're on specific medication, you're having medication changes. The other thing is that whenever a doctor is putting you on medication, question them why you're taking it. And like Dr. Coy said, also question or really get to know what is the game plan. So as a physician, if somebody comes in, I have them on blood pressure medicine, I like to explain the game plan to them, but I also like to find out what is their game plan, what do they want to do. If they want to be on medication, hey, that's fine, I'll leave you on the medication. If you want to come off the medicine, then yes, I want to get you to work with a team of different providers, and we'll work on getting you off the medication. But as a patient, you actually have to do your job. A lot of people think that it's the doctor that's supposed to do all the work. We can only lead you to water, but we actually have to have the patient do a lot of the work, a lot of the groundwork to get their health under control. We can explain these are the reasons why these things are happening. If you would go back and change some of the things you're doing, and we'll specifically say what should be changed, then that's helpful as long as the patient's doing it. But if we're just telling them, hey, your car's out of oil, we need you to add oil in it, but you never do, then your body's not going to run better, just like your car's not going to run any better.
Cool. Dr. Coy, anything?
No, I think that's well put. I appreciate that.
Cool. Yep. Perfect. G23, thank you for that. Thank you so much. I mean, that's what we're here for. You know, we all grew up together, so it's fun getting on here. We actually get to see each other more often now. So that's why I love it too. We get to have fun, chat, and provide information to you all. Thank you all so much. We do challenge you all with taking a look at your diet. That's one of the biggest things. Take a look at your diet. What is one thing you could fix about your diet? Is it increasing your vegetable intake? Is it decreasing the amount of meat that you're consuming? Is it decreasing the amount of salt? We talked about salt. Is it decreasing the amount of salt or something of that nature? Or how about increasing the amount of exercise or removing the caffeine? What we want to do is challenge you all to see what can you do to correct your diet, and also challenge yourselves with talking to your primary care physician. Call them up, visit them, whatever, you pay insurance, visit them, talk to them, and then ask questions. That's what we challenge you all with doing. Until our next live, we challenge you, hey, ask those doctors questions. And then when we come back for our next live, let us know, hey, I challenged my doctor, because that's one thing. I'm keeping y'all up, my bad. So that's one thing. My mom's like, hey, I listened to y'all live. I questioned my doctors, and they were surprised. And that's what we love to hear. And yeah, even my mom was like, oh, she actually paid attention to us. Normally it's the other way around. But that's what we highly recommend. Challenge your doctors. Talk to them, not fight them or anything. But if they recommend a medication, why am I taking this medication? Explain to me, how is this medication happening? Like they said, what is the game plan? That's our biggest thing. That's what we challenge you with. Until next time, you all have a good one and have a good night.
See y'all.